for community in crisis, community connection. We're physically located in Burnsville, New Jersey. So 30 years experience, that says I'm old. So it's good to look around the room and see some familiar faces, some familiar names on the screen. I would ask, since we're in helping professions, what would be real helpful for us is if you can, it's possible to keep your camera on so that we can see folks' reactions to our presentation. This is a brand new presentation for David and I. So we want to gauge everyone's reaction and hopefully keep you engaged. Without further ado, we're going to, those two could complete it, it'd be great. All right, so it looks like most everyone has either strongly agrees or agrees that they have an understanding of what the peer recovery movement is. But in order to discuss the peer recovery friendly workplace, we'd like to set the stage with discussing what peer recovery is and what the little history of the peer recovery movement. So that's where I'm going. That's where I'm going to begin. And I want to get it. That's okay. So you are at, in case you didn't remember what you registered for, you're at the RFW workshop, and it's presented by Community in Crisis and Human Services Academy. And we're really glad everyone's here this morning. So what is peer recovery? I've put the definitions on the board, but for me, I think the most important aspect of peer recovery is the idea of someone who has walked the walk previously, that's walking alongside someone that's having the experience currently. So it's when someone who's been there talks to someone who is there that the magic of peer recovery happens. So peer support's been described as a system of giving and receiving help based on the key principles of shared responsibility and the mutual agreement of what is helpful. So again, so much of the paradigm in the past was we had this prescribed notion of what recovery should look like for the individual, and we tried to bang round pegs into square holes. And the new paradigm of the peer movement is very much engaging the individual as to what they see as what recovery looks like to them and how we can help them have a more successful journey on that recovery path. New Jersey has a certified credentialing program, whether it's the CPRS certification or the CCAR certification, and there are requirements: 46 hours of classroom instruction, 500 hours of volunteer hours, and 25 hours of supervised hours in order to become a certified peer recovery specialist. So, we are trained. We're not just, the old model was just peer-to-peer, and this, there is a framework of training along there. So that's what the peer recovery, is in a nutshell. So we asked, like, why peer recovery? Like, if it was already working, why change things? And my take on it is recovery was working to a point, but the peer dynamic and a credentialed peer workforce, brings that level of authenticity to the participant that someone else who's just read it out of a book may not have. So SAMHSA has done a study, and their results are, what it does for the individuals. It helps to increase their self-esteem and their confidence, their sense of hope and inspiration, increase engagement in self-care and wellness, reduces hospital admission rates and longer community tenure, so they'll longer engage with services, and probably most importantly, decrease substance use and depression for the individual that's engaged with peer recovery. So with that being said, when we look at systems of care, we really want to make sure that we're delivering systems of care with the recovery focused lens, and that is defined as a recovery oriented system of care, or ROSC. And there's a long SAMHSA definition on the screen right now. SAMHSA defines recovery oriented system of care as a coordinated network of community based services and supports that is person centered and builds on the strengths and resiliencies of individuals, families, and communities to achieve improved health, wellness, and the quality of life for those with or at risk of mental health and substance use concerns. So, the big takeaway of recovery-oriented system of care is allowing the recovery, the person in recovery or trying to access services, that they have a say in how the system of care are delivered, formulating the systems of care, follow up on the system of care. The person in recovery or accessing recovery is fully engaged in the entire process. So no longer just this, again, top-down theory, it's more engaging the individual on a one. So here we go. I'll run through the slides so you can at least see them, but I've already given you the it wouldn't be Zoom if there wasn't a hiccup. So I'm determined in year 4 to learn how to do Zoom. So here we go. So here's our slide into what is peer recovery, why we're engaged with peer recovery, the ROSC system of care, recovery-oriented systems of care. And now we'll get into a little bit of the history of where the peer movement has come from. So the very earliest iterations of formalized peer work in the United States, particularly, and was the temperance movement. So, those things from the 1800s where you'd seen people smashing kegs of beer and people signing abstinence pledges. That was the first peer movement, and it was in reaction to the United States had a very severe alcohol problem back in the early to mid 1700s, and that's where it came out of. In the late 1800s, a movement came along called the Washingtonians, and the Washingtonians took a little bit of the temperance movement, but they also added the idea of one-on-one interaction with folks, people sharing their story of recovery, their story of transformation. And the Washingtonians were around pre-Civil War, and they even had a young guy called Abraham Lincoln who came out and addressed them. They were much bigger than Alcoholics Anonymous is now. They probably had equivalent of 3 to 4 million people were involved with the Washingtonian movement. And it quickly went off the scene because they lost their direction. They started getting involved with a lot of other stuff. In the 1900s, the Oxford groups came along, and they were this transformative organization who believed that, if you help transform leaders in society, that they could better carry the message to others. And they had some early Christian roots, and out of the Oxford group came the AA movement, which started in 1935. And AA is where the 12-step movement began. And the 12-step model from 1935 to probably the early 70s was the predominant model of recovery in our country. And in fact, there are over 200 groups that are modeled off of the 12-step model. So it is successful for a lot of people, but in the late 70s, people started looking at some other avenues of recovery support. The peer movement itself has its roots in the 50s and 60s in the civil rights movement of a people-powered movement of action and advocacy. In the 1970s, you saw a lot of litigation, a lot of federal laws around recovery and mental health concerns. Recovery homes and halfway houses started to predominate the scene. The 1970s also saw the rise of the mental health peer movement. So the mental health peer movement has been around much longer than the addiction recovery, peer recovery movement. And we're grateful for their guidance and leadership. And then in the 1980s, the AIDS crisis again was a people-powered movement of a stigmatized community that rose up and really tried to advocate for change for their constituents, and that's what drives the addiction peer recovery movement. So in the year 2000, a gentleman named William White, who some call the founder of the New Recovery Movement, delivered an address called "Toward a New Recovery Movement: reflections on recovery, treatment, and advocacy. And he, previous to that, he had written a 400 or 500 page book called Slaying the Dragon that laid out, the peer recovery and laid out the movement of abstinence and other things that folks have done over the years to try and work with their substance use disorders. And he said that it was time that, we came out of the shadows and stopped, trying to hide behind the anonymity and recover out loud and let other folks know that recovery was this life-saving process. In 2000s also saw this body of evidence of what the peer recovery movement actually does for the person in recovery. And from that, there are a bunch of conferences and a lot of momentum around it. In the year 2013, the movie, The Anonymous People came out. And for me, that was a turning point for me in my own journey of advocacy and the peer movement. So New Jersey's peer recovery movement. In 2009, Eva's Village became the first peer recovery center in the state of New Jersey, quickly followed by Living Proof down in South Jersey. From there, others came on board, like Prevention Resources and Morris County Prevention is Key and others throughout the state. And in 2022, DMOS was determined to have a peer recovery center in every county in New Jersey. And they put out the Community Peer Recovery Center grants. And that's where Community in Crisis began our journey as the Somerset County Peer Recovery Center. So New Jersey is the first state in the country to have a peer recovery center in every county in our state. So that's something to be proud of. So what are the challenges of the peer movement going forward? Much like other illnesses, there's stigma around addiction, not only folks accessing treatment, but also people in recovery. Integration, so integrating the peer recovery specialists into all levels of care, whether it's hospitals, law enforcement, justice involved situations, integrating peers into those. Equity, so making sure that the peer movement's open to all, not just a select few, and that we're really focusing on the communities that have health disparities. Also adopting a harm reduction model, recognizing that abstinence may not be a pathway for everyone, and we have to keep folks alive in order for them to access treatment. And lastly, innovation, such initiatives as we're going to hear more about the recovery friendly workplace and other recovery friendly community initiatives to help move the peer movement forward. And with that, I'm going to turn it over to my partner, David Martinak, and he will take you through the next section.
Okay, it looks like based on the results here, they're as expected that we've got a mix of neither agree or disagree and agree in terms of recovery friendly workplace and how people are comfortable assessing resources that are available. That's a very typical result. And I'll deal with the other answer later in the presentation. I'd like to see the results here though. The workplace. Let's just start off why, as Ken just finished, we're a peer recovery center here in Somerset County. So why are we engaged with this? We're one of 21 peer recovery centers. We are people with lived experience, meeting people where they're at and getting to where they need to be. We focus on the 4 pillars of recovery: health, home, purpose, and community. And if you think about it, every element of those is affected significantly by our vocation, about where we work, how we work, addresses each one of those pillars. So it's a common denominator to all of those. Another common denominator is it's often the source of symptoms for us that, that dealing with things like stress, conflict, tension, worry, self-worth, etc. So there's all these reasons as to why we are engaged with this specific topic. So the Recovery Friendly Workplace Initiative, we didn't come up with the idea. This is something pretty new, though. It started a few years ago, largely promoted by Governor Sununu out of New Hampshire, initially launched it. And since then, a number of states have been picking up, including our neighboring states, Pennsylvania, Rhode Island, Connecticut. All of them are picking up. And what's a little different about this is that it's an employer-driven initiative as employees and employee. We have a number of employee initiatives like Career One, or here in Somerset County, Greater Ryerson Workforce Development. These are focusing on training aspects and reentry aspects, justice involved people, and so on, getting them back into the workplace. But the Recovery Friendly Workplace movement is complementary to all of that work, but it's driven from the employer, that's focused on changing the cultural atmosphere inside the workplace. It's changing into something that's a little more empathetic and focusing on areas of substance use and co-occurring mental health concerns. One of the statistics that I came across really early in this, when starting to look into this process of Recovery Friendly Workplace, was 70% of the persons with untreated substance use disorder are currently employed. So what does that mean? That just hit me largely, because it means we're out there, we're in the workplace, we're on the payroll. So the primary objectives of the Recovery Friendly Workplace are just to combat the stigma towards substance use. It's towards realize there's actually financial benefits towards this for the company by adapting these practices. And thirdly is to connect the organizations and the individuals, the employees, with the resources needed that are available in the community. Regarding the stigma, if you think about this, it's probably the most important factor, especially early in the process of developing a recovery-friendly workplace. If I said to you, just think of your reactions. If I said to you, I quit smoking today, a week ago, and think of how you respond to that. Then if I told you that, hey, I quit drinking a week ago, then you might have some different response to that. And thirdly, if I was to say, hey, I have an opioid, issue, or I have a family member that has it, and you have a different response to each of those. So it's important that we're focusing on combating that stigma that exists. There is, as I mentioned earlier, there is returns on investment for the company itself. People in recovery have known to have improved productivity, absenteeism, and presenteeism is all improved, retention, even decreasing healthcare premiums and improving the wellness. And it's no secret that substance use is costing industries billions per year each year. The bottom line, so it's estimated in terms of cost around $7 billion per year in the country, and we estimate in Somerset County alone about $400 million per year. Nearly 2 out of every 10 employees are experiencing some sort of substance use disorder, and even the number gets much larger if we're looking at people, the family members or loved ones that have been affected by it as well. So in short, employers have a big stake in the recovery-friendly environment, and the returns on investment are clear. This is just giving you some numbers. There's actually calculators available online where you can plug in the number of employees you have, and it'll give you an estimate of cost savings per year. You can see that industry on the average is around $6,000 just in savings per year per employee with substance use disorder. So there's big investment there. It changes per industry. Some industries are hit harder than others. For example, the construction industry is closer to $13,000 per year. So, and it depends on the number of employees and the attitude towards it. But on top of it, it's not just the cost savings, but actually there's cost benefits. People in recovery have fewer missed days than general workforce, so they actually are an improvement. And people in recovery have lower turnover rates. They're more loyal to the workforce if they're given these opportunities. Lastly, there's also a push towards getting government incentives and tax credits for organizations and companies that adapt recovery-friendly workplaces. Here's some statistics from the latest SAMHSA report. I think it was 2021. Just looking at the cost of alcohol misuse, 250 billion per year, illicit drugs, 193 billion. The number of persons with substance use disorder, 30 million. For alcohol, drugs, 24 million. We estimate in Somerset County alone, 57,000. And as mentioned before, 70% of these individuals are actively employed. And 1 out of 4 Americans report mental health struggles. So the bottom line, what really these statistics talk to us is that alcohol is still a big concern, as well as the big push against the illicit drugs and opioid concerns that we have. Substance use is costly, but it's also preventable and treatable. I always like to say that substance use is a choice until it's not. And when it's not, it's called addiction. An addiction is an illness or a disease, and it is treatable. And the sooner, like any other disease, the sooner it's diagnosed and treated, the more likely that it's preventable and treatable. So recovery works. If we were to look at the people in recovery, then we're turning the page to the people in recovery, and we estimate there's about 55,000 in New Jersey or in Somerset County, and that would fill Patriot Stadium 9 times. It's significantly higher if we include the family members and loved ones that are affected by that. Bottom line is, again, it's a big source of resources that's available to us. This is particularly important in this time when we're struggling finding the employment. People are having trouble finding a number of people to fill the jobs that are available. So let's get a little more. What is recovery friendly workplace? I like to start with what it's not. Recovery friendly workplace is not primarily programmed to hire alcoholics and addicts and junkies. That's because we're already on the payroll. Recovery friendly workplace does not diminish safety or security in the workplace. It does not encourage drug use in the workplace. It does not instill fear in employees for disclosing their addiction and recovery status. So those are the things it's not. But what is recovery-friendly workplace? It's one that's committed to fighting the stigma associated with substance use and mental health concerns. It's recognizing that addiction is a disease or an illness that can be treated like any other illness. It's a commitment to providing our employees with the tools necessary to achieve recovery. It's a commitment to hiring and retaining employees or individuals that have been affected by substance use. And it's a commitment to our employees at all levels on a continuous education and training programs needed to maintain a recovery-friendly workplace. Basically, it creates and changes a workplace that fosters a empathetic and safe and respectful environment. So what we've done, we've developed a process for taking an organization through a recovery-friendly workplace. It's a 3-step phase, usually several weeks to get through the first phase, which a company achieves a designation status. And then after that, we do assessment and trainings and so on to continue the practices of a recovery-friendly workplace. So what can you do as an individual or as an organization or as a team to adapt recovery-friendly workplace? So let's look at a few good examples of what you can start doing today. First one is language matters. I'll give you a little example on this. I used to, when I was in active use, I'd have two guys on my shoulder. One was a good guy and one was a bad guy. And the one guy would talk to me and he'd say, "Hey, Dave, you should stop drinking." And then the bad guy would say, "What, you're going to listen to an alcoholic?" So language, there's a lot to be said in that little statement, you know, it's because it also affects how you look at yourself. Because the language used is not just on how you're harming somebody else, but it's also the stigma that you cast upon yourself. In 1987, the medical community formally reclassified addiction as a disease, joining the list of cancer, Alzheimer's, anxiety, and other concerns. But our language hasn't kept pace with it as it matters in this field. We say the word alcoholic, but we don't say cancerholic. Why? So I'd like to do a little exercise with everyone. If you see the result, if I say the word addiction, if you could just type in your chat the first word that comes to your mind. Yes.
Yep. Yes. Recovery, drugs, suffering, roller coaster, dependence, illness, dependence, pain, substance dependency.
What's a good one there? Roller coaster?
Yeah. Unreliable,
Unreliable.
illness, frustrating, illness.
Okay. Good one. I like roller Tron. Okay. Roller coaster is the first time I heard that one. Was the other one unreliable a few times? Okay. Okay. It was just an exercise to see what was the first response to. So very common. You know, quite often we hear the words abuse, abuser, clean, dirty, junkie, addict, alcoholic. How about though things like teetotaler or lightweight or fell off the wagon? That's gotta hurt. I know it did for me. I've been there a few times. So these are all language that have their place, and it's not just the words themselves. Quite often it's the intention behind the usage of the word and how you're using it in the context in which you use it that makes it, you know, that its infliction is harder. So it not only affects, like I said before, not affects the person that you're addressing it to, but also yourself, how you look at it as yourself. If I call myself an addict, or I'm putting blame, denial, guilt, moral failing, all these things are actually part of that discussion. And it puts me into emotional isolation long before any physical isolation. I go into an emotional isolation. But changing our language is something we could do right away. It's simple and it's powerful for everyone, and it can make an impact on all those that you interact with every day. There's a comedian that he says, alcoholism is a disease, but it's the only disease you get yelled at for having. For example, Dave, you're an alcoholic, but also Dave, you've got Alzheimer's. You know, you don't yell at yourself for having it. Next topic that you could do right away is empathy. Let's change the approach to it. The workplace environment can often use productivity, timeliness, getting the job done as an excuse to override empathy. And it can run through the organization. You can think of someone giving the instruction, I don't care if you're not feeling well, unless you're on a stretcher, I want to see that truck out the door by 4:30 this afternoon. Or you've got a hangover, I've got a cure for a hangover, you're fired. These are very tough tough responses, but they exist in our workplaces. In fact, there's a book that I'll promote here. I'll just name. It's called No Asshole Rule. And came out of the Harvard Business Review. And it's really about bullying in the workplace and how, so empathy is not just about substance use, and as we'll talk about it today, but it applies across the board. And the book and the article that the guy wrote was about how much this can actually cost industry. So I like this quote that I put up on the screen here: "Be kind, for everyone you meet is fighting a battle that you know nothing about." And that comes from, actually happens to be a New Jersey author, Wendy Mass, from a children's book called The Candy Makers. But it serves as a reminder to us all of what we don't know, what somebody's struggling with, or personal challenges that they have that's not visible on the surface. It highlights the importance of empathy and treating others with kindness, regardless of what we know about their circumstances. That's what empathy is. And it applies not just to individuals that are experienced, but again, family members and loved ones. It's actively putting yourself in their shoes and connecting with their emotions. Hence, peers with lived experience. Ken and I both are people with lived experience, with both a lot of business background that has been the crossroads for a lot of our recovery aspects and path to recovery. So let's do a little exercise. Imagine you work in a team with a colleague named Alex. Over the past few months, you've noticed that Alex's performance has been deteriorating. They frequently come to work late, miss deadlines, and seem disengaged during team meetings. You notice that their physical appearance has changed, and there are times when they smell of alcohol. Instead of immediately judging or reprimanding Alex, you decide to approach the situation with empathy. You recognize that substance use issue can be complex and personal, and it's important to handle the situation delicately. We'll just take a moment and think about that. Normally, we would have a dialogue, but that's hard to do on a Zoom call. So we'll just move to. So this is where you take out all the tools, and if you're into social work or studied social services or human services, then you go to your toolbox of tools and you bring them out and start putting them into practice. Having conversation, active listening, empathetic response, encouraging, looking at what resources are available to help, and most importantly, patience and understanding. By approaching it with empathy, you create that environment that your colleague needs to get them along into where they need to go. And this is one of the largest, I think, elements of a recovery-friendly workplace, again, very early on in the process, and something that you can start today. Another thing that we'd like to push for and early on in the process is to really understand what recovery support groups are out there. There's more than's ever been available, I believe, in this area. For the longest time, it was AA or NA, but we have Al-Anon, we have Smart Recovery, we have different groups within those as well, dealing with specific areas like LGBTQ, Sexaholics Anonymous, mental health support. And then the area I'd like to talk about too, because I think it really addresses that 70% of people that are in the workplace right now that have a substance use disorder, and that's sober curious. And something I know is called moderation management. It's part of my journey, but even though I choose abstinence, I'm still engaged with it because I feel if people have the opportunity to start exploring, questioning their relationship with their substance of choice, this is a very important step. And sometimes, it's a big step, big leap to jump into something that's abstinence-based and maybe not even required. So the point is that, it can be, and I like to treat things like moderation management and sober curious, treat them as paths of recovery because they really are. if we go back to the idea that it's an illness and a disease, and the sooner you treat it, the more likely that it's preventable and treatable. And that's where I think we can start talking about this. They're basically, although moderation, management, and sober curious focus on alcohol, they are forms of harm reduction. And we can take the lessons we learned there and apply them also into our harm reduction models. Lastly, what you can do as an organization now is to be aware of what resources are available in your community, what's locally available. Narcan, do you have Narcan on the shelf? Do you have it in your emergency first aid kit at the office? Do you carry it in your car? These are things that they're available. Narcan's available to us free of charge here in New Jersey. So these are things, all these 4 things that I just listed are things that you can start practicing now to be a recovery-friendly workplace. And I'm going to turn it back over to Kim, but before I do, just on that survey, it was interesting that we had nobody indicate that 70% of the, I think I had 0 results for the actual answer, that there's 70% of the people with substance use disorder are employed. Most of it were in the 50% category and 25% category areas, those areas. So it's just interesting to know. So I'll turn it back over to Ken for the next session.
Thanks, Dave. And not only did I forget to do my PowerPoint share screen, but I also forgot to do a video. So we're going to start off with a poll, and then we will, I'll do a quick video, and then after that, jump into my presentation. Let me see if I can get the right poll question up. All right, so here's a poll question on everybody's familiarity with recovery-friendly communities. So quickly, speaking of polls, I had also dropped a poll in the chat box that we're currently doing regarding trauma-informed recovery-oriented systems of care. And if possible, if you're able to access the survey, really appreciate it if you could fill that out so we can better serve the recovery community in Somerset County. I know some of you on the call today are actually on our TIROS work group, but if you could fill that survey out. My understanding, someone let me know that county computers cannot access Google Forms, then I will see if we can come up with an alternate for everyone. But if I'll drop it back in the chat box after I'm done my presentation. But thank you for that. So let me pull up my video real quick. So it's a 1-minute video that, of course, I can't find right now. All right, so here we go. Share my screen. And this is about community in crisis. So. Thank you, everyone for watching that. And
the actors are great in that. I really like the dog.
We like to have fun in recovery. So I'm going to talk a little about what recovery-friendly communities, not just a recovery-friendly workplace, may look like, and some of the efforts that we're doing here at Community in Crisis, Community in Connection to help deliver on that recovery-friendly community messaging. So, first of all, we also, as an organization, offer a bunch of prevention, early education regarding substance use disorders, vaping, and now actually doing more programming around youth mental health. And I always go back to what Desmond Tutu said, we're the recovery support team, we're in the business of pulling people out of the river, and prevention is, trying to find out why they're falling in the first place. And if we can prevent them from falling in, then hopefully we can put the recovery support team out of business, because we won't have to fish folks out of the river. So prevention is definitely, and hopefully as time goes on, more integrated in the recovery support movement. So right here in Somerset County.
You have to share your slide. We're still seeing the end of the video.
Still seeing the end of the video.
Wow, okay. Interesting. So this was Ken's very first PowerPoint that I put together. So so not only is my first time putting it out, it's also my first time doing a PowerPoint presentation. So please excuse me. So what we're doing in terms of Somerset County outreach, particularly, we have our Peer Recovery Center here. We also do what we call Peer Recovery pop-up events. So we are currently monthly in the town of North Plainfield and the town of Boundbrook. And we're there from 3 to 7 on the first and second Thursday of the month. And hopefully, well, very shortly in September, we're going to launch in Franklin Township. And our direction with that was based on high rate of fatal overdoses and also low recovery capital. So those towns, did not have a lot of services in the town. So we're hoping to connect folks one-on-one with those services. We also do telephone and virtual recovery support. So we will proactively speak with the peer one-on-one on their schedule. One of our current associates, Ismael Rodriguez, is bilingual, and that's been a game changer for us to reach out to the Latino community and do a lot of outreach there. It's really been awesome. We also do a bunch of tabling events out in the communities, trainings and workshops. So we offer free Narcan training. Right now we're doing a quarterly with RWJ. We also have a harm reduction workshop that's being finalized for October. And that all falls into the harm reduction initiative. So we have on site, we have Narcan and fentanyl test strips, low barrier, just come in and grab them. When we're out in the community, we're also supplying them to folks with no questions asked. So along those lines of harm reduction and other services, as I said, we do a Narcan training, recognizing that xylazine is now poisoning the illicit drug supply. We also are doing some education around that. We also, we do have xylazine test strips. They are available. The legality of that is still being worked out, but we have them if folks need them. If someone happens to take one and we don't know about it, then that's okay. Also mental health first aid training. So as an organization, that's something else that we offer not only to organizations, but also the wider community. Multiple pathways of recovery. So again, not hammering square pegs and round holes. We offer a bunch of different types of recovery support meetings. So we have an LGBTQ AA meeting that meets here in person. We have a family support meeting that's led by a clinician, free of charge, twice a month, hybrid format. So many folks are having a hard time getting a therapist currently, but we have a free support group that's led by a clinician. We also do smart recovery. We do noble steps. Dave leads a moderation management meeting. So, and also if anyone in the community is looking for something that we're not doing, whether it's recovery support or recovery friendly activities, if we can help support that and help them have a platform for that, then we're more than willing to work with folks along those lines. And then we do a bunch of recovery-friendly activities, everything from birding to weekends away to karaoke. Monthly, we do have an all recovery meeting that's called Canines for Recovery, where you can bring your dog to the recovery meeting. And it's open again to all, not only the person in recovery, but their family members, allies. So it's really been an interesting thing to watch. And that meeting just celebrated its first anniversary, and it's interesting how people engage around their pets, and we're really happy to be able to offer that. So those are primarily the things we do in terms of recovery friendly community. And then another area that we focus on is recovery friendly congregations. So we do a monthly newsletter called Congregations in Conversation, where we try and offer our faith leaders resources for them, which we all work in helping professions, and you'd be surprised how much information that they don't know, and the ability to be able to give them that information. We also have a dedicated webpage for our faith leaders, a toolkit for them that has lots of resources, including our own Somerset County Behavioral Health Navigators contact information. We also do quarterly faith leaders meetings in a hybrid format. So as we're expanding into the larger county, trying to engage as many Somerset County faith leaders in our quarterly meeting. Faith-based recovery initiatives, that's another one that we support as much as we can. And then coming up in August, we're doing Overdose Awareness Day, and we've gotten 14 houses of worship that have offered to allow us to put out purple flags and placards to recognize all the citizens from Somerset County that we've lost to the overdose epidemic. And then the next day, going into September, many of them have agreed to put up a banner for Recovery Month. So it's great to have those allies, and just one more aspect of a total recovery community. Then the last big aspect that we're working on in terms of recovery friendly community is recovery friendly government. So Somerset County Services, we're looking forward to the helps van coming out to our pop-up shortly. And I can tell you that my experience with the county is they're very responsive, and really been a great asset to help us loan our recovery support efforts. We are part of the Municipal Alliance. We also go out monthly to Recovery Court and interact with the participants and let them know all the resources that we offer, and hopefully connect them to the resources that they need. We are, as an organization, part of Operation Helping Hand, which is an initiative through the prosecutor's office that proactively goes out into the community. We did train the EMS and fire department in North Plainfield regarding the services that we offer, low barrier Narcan, and reminding them that we can be an asset to folks before they wind up seeing them, and if they know someone in the community that needs help, to connect them with us. And the last big one is schools, and trying to look at recovery friendly campuses, and whether it's high schools or colleges, how we can integrate a recovery focused message into our school systems. And that concludes my experience with PowerPoint. So thank you everyone for your patience. Again, I really appreciate it. And I'm going to turn it back over to Dave to conclude our presentation today. So thank you.
Okay. One more poll. Start off with. How do I? So there's 2 questions in this poll. If you could take a moment just to give your responses. Do they see? Wow. Looks like we have most everybody's responded. Interesting. I like the results on the first question. I know where, sorry, can I share this? So this is we're good.
Yep.
The last section, what I call allies and advocacy, the last part of our thing. So once again, it's a little more about what we can all do in this field of recovery, and as it also relates to the workspace as well. So the first thing, there's plenty of allies out there in our government agencies and quasi-government or nonprofit fields. There's some really interesting groups. Faces and Voices of Recovery have been around for a while, been a real leader in this. Here in New Jersey, we have the Coalition for Addiction Recovery Support, our Stop Stigma campaigns, stigma-free campaigns throughout New Jersey, throughout Somerset County is very, they're very active here in Somerset County. Ken mentioned Operation Helping Hand, also Hope One in Morris County. Our police, our EMS teams. Ken spoke about how we have reached out to them as a peer recovery center and are trying to be partnering, and just letting them know we're part of the resources that are available in this field. So there's plenty of allies out there, and it's important that you, as an individual, recognize that and get to know them. That's part of the whole practice of being of advocating. It's the first steps. There's also community allies. We have our peer recovery center as a community, recovery friendly schools. Ken mentioned briefly the faith-based organizations of all sorts have been very engaged and responsive to a lot of our initiatives. As Ken mentioned, also the business community has been excellent. Again, stigma-free, you'll see a lot of businesses adopt that practice. So we've got a lot of allies in the community, and you can be one of those allies or engaged in that. Particular if you get involved yourself, whether through volunteering or maybe you're already on boards or whatever you might be able to do, is actively get engaged. Which advocacy. So Ken doesn't like this, but recovery is political. I think it is. There's political aspects to recovery. It's political, but it's nonpartisan. This is not red or blue, it's nonpartisan. And probably one of the best examples of the politics of recovery could be the war on drugs that we experienced since the 1970s. It was a global campaign led by the US to combat, illegal drug trade and to deal with it here at home. But it has significant political, social, economic implications from it. We had legislation and criminalization, strict laws and penalties that for drug-related offenses, and it often ending in ended up with long prison sentences for nonviolent offenders. There was racial disparities. Those drug laws and enforcement activities disproportionately affected certain communities, and disparities in arrest and incarceration rates. It also had implications outside of the US, our foreign policy and international relations, significant effect, particularly in Central and South America. It had effects on our law enforcement and policing aspects too, combating the drug, our different approaches to it that influenced how we allocated resources and the community interactions that we had. Public health and treatment. It diverted resources away from public health initiatives and for those that could use treatment programs. There's also an increased stigmatization that went around it and public perception on the war on drugs. Just the fact that it's called war on drugs had a very strong perception. So we've learned from that. Hopefully, we've taken a step back from that and realized that a lot of advocates and experts, there's been numerous reports, of course, on this study that have argued that a shift towards a public health approach that prioritizes things like harm reduction and evidence-based treatment is definitely a better approach to the problem than a punitive approach. So advocacy is something we can all do too at every level. Most importantly is probably at your local level. Advocating for recovery is a lot like advocating for climate change. There's so many strategies and agendas and things you have to look at, but it's important to be engaged, and we can help make a difference. Another thing you can do is cultivate recovery capital. Recovery capital is exactly that. It's building up potential, building up, in electrical terms, we call it voltage. It's the capacity that we have to address the problem, and it's important to cultivate it. I put here that recovery is purple. That's the color of recovery. I like to say, because it's not, again, going back to the political, it's not blue or red. It's somewhere in the middle. It's purple. It's neither. And also recovery is September. The month of September is recovery month. Stigma is a noxious force. I think that, again, we emphasize the importance of stigma and how we can address that, through being compassionate, empathetic, language matters, how you interact, and you talk about this subject matter, it matters. How you approach it, how you approach, empathetic approach, open conversations, volunteering, engagement, understanding there's multiple paths to recovery. These are all things that are, that we can start doing right away, right today. In the community, what we're doing by being active in this area is to create basically scaffolding. If you're thinking of building something, repairing something, we're building scaffolding for individuals that it means that they can grow and heal from their conditions, and taking a public health approach to this problem. That is what's behind the concept of cultivating recovery capital. Again, we focus on what we focus on here, the 4 pillars of recovery: home, health, purpose, and community. If we start focusing on those things, we take away and addressing those, the less chances we have of people falling down the substance use rabbit hole. And all of us as our allies, we can be powerful. And it's not just, again, the individuals in recovery, but it's the families and friends that have been affected by our very powerful voices. We should be aware too that, we live in New Jersey is very active in this area. We're one of the leaders, I would say, across the country in this whole movement, recovery movement, very active. We have a good system, good responses to it. The more rural and low income communities, sometimes are referred to as recovery deserts. They just don't have the resources that we have available. And we even have that inside New Jersey. There's certain areas, but going outside, can be more pronounced. So for all you that have a chance, this is a chance to get active, maybe at every level, whatever you're involved with. If you're a policymaker, if you're an influencer or business leader, you can all get engaged in this area. And just to finish off on our recovery-friendly workplace. So this is just to emphasize, because that was kind of the theme of today, was the recovery-friendly workplace. It is an initiative that we started here, really started putting it together early in the year, this year, coming up with a plan if I'll go forward, and launched it only a couple months ago. And so it's a pilot project here in Somerset County. It's the first one in New Jersey, and we would like to be the model to make it a statewide movement. And we see the best way to deliver it is through organizations like ourselves, like the community peer recovery centers that have been established already and really are the backbone for delivering this type of program. But also, we're probably one of the most important resources for companies to turn to and for individuals to turn to that are experiencing this in the workplace. And that's about it. And I think at this point, we will open it up for any questions.
Yep.
At this point. And thank you all for your participation. The responses were excellent. And engagement.
I have a question, Dave. What's presenteeism?
Presenteeism, Ken. Presentee is the act of being present, as opposed to absenteeism. We always think of looking at it as who didn't show up. But somebody might show up, but they're just not present. I can think of a number of days that I showed up to work and I sure as heck wasn't present. So whether it be from recovering from the night before or whatever the case might be. Yeah. So that's presenteeism.
It's also important to remember that, family members too. So, we're talking about recovery-friendly workplaces and that, presenteeism is a huge impact on family members that, where you have the mom or the father or the brother or sister that's there and they're concerned about their loved one and they've shown up to work, but they're not present at work and where's their productivity level. So having a recovery-friendly workplace where someone feels comfortable in sharing what's going on and the ability to access resources will help, hopefully to have them more engaged when they are at work, to have them fully present when they're there. Another important thing with a recovery-friendly workplace, like my friend Chris, who was on the call earlier, reminded me is that, very often somebody at work will say, I need to go to my kid's ball game and most employers like, oh, sure, go to the ball game. But, what happens if that same employee says I need to leave early to go to a recovery meeting? Do we treat them the same way? And if not, why not? So recovery-friendly workplaces is not changing how we treat everybody in the workplace, but it is about looking at those people empathetically and seeing if we can accommodate that their recovery and their needs for sustained recovery. So
I see. Thanks, Ken. I see we have another question. Do you have any recommendations for individuals who want to work in this field as peer recovery specialists?
So there are a number of organizations that offer trainings currently. So NJPN is New Jersey Prevention Network, who typically offers it quarterly. Prevention Links is another one that very often will offer free training. We just concluded a fantastic program with the Greater Raritan Workforce Development Board called Pathways to Recovery, where we were able to actually pay for folks as interns while they complete their 500 hours of training, as well as them getting covered for the CPRS training. There are a number of other organizations out there that charge for the training. And very often with those, there's also scholarship opportunities, but there's any number of organizations out there that you can get your CPRS training. We would also like to offer, though, if folks need an avenue to complete their 500 hours of volunteer work, we'd be more than happy to engage them and bring them on board as interns and help them get fully trained in the recovery field. So. Any other questions? Chris, I see a hand.
How you guys doing? Great presentation today. Just a quick question. When you talk about the established recovery centers within the state, do you happen to have a list of each one in each county that you can get out to us?
Yes. And gratefully, through one of our interns here, we literally just got it listed on the Reach NJ website, and it hadn't been there. And we've had a recovery center in every community for over a year now, and
Right.
so that it's listed on that site.
Reach
But
out, Jay.
we will get it out there. I've got your email, so. And for those folks that answered, they weren't sure where to get Narcan, just to amplify what Dave said. There is a program currently, there's a big $3 million ad campaign around it called Narcan 365. So anyone that's 14 years and older in the state of New Jersey can walk into a participating pharmacy and speak to the pharmacist and receive a free Narcan kit. There are over 500 participating pharmacies right now. There is a link that you can look and it'll tell you, which pharmacies are in which counties. And again, that's free of charge through your pharmacy. We, as a recovery center, as I said, we keep it out all the time. If you need some, we will readily give it to you. But yeah, Narcan, and gratefully in the state of New Jersey, is readily available. So please reach out. We have a Narcan training coming up on the 25th of August. And that if you complete the training, you'll get sent a free kit in the mail. It's only an hour-long Zoom. You can do it, from the comfort of your home, and the kit will be sent directly to you. Are there any other questions? Well, thank you, everybody, for your engagement.
Thank you.
Rena did put in the chat the information about getting the CEUs. I did drop the link in the chat for the TI-ROSC survey. So that's a trauma-informed, recovery-oriented systems of care. And we'd like as much input from county residents. And you don't have to work in the field. As long as you're a resident or you work in Somerset County, we'd love to get your input on that. I will work on the fact that Google Forms are not accessible at county level, if I can do that. But we'd really appreciate if you fill those out. When you fill out the surveys, please be brutally honest, because this is our first time doing this. So we want to be able to learn. Just saying it was great really doesn't help us, or it was good. Let us know where we need to improve. And I know Ken needs to improve on his PowerPoint skills. So please go gentle on us. It's our first time. So thank you all.
You just said be critical and then said be gentle on it.
Well, you can gently criticize us. It's like, brutal honesty. You can be honest. You don't have to be brutal about it.
Okay.
So I've heard that brutal honesty is just brutal.